Welcome back to the Nursing Ministry channel, ladies and gentlemen, a platform where I discuss all matters nursing, professionally and also as a ministry. Thank you for tuning back in. Looking back at the previous episode, I had mentioned that we are going to discuss matters nursing. As a profession, we are going to look at the various hierarchies that are involved, the curriculum that a nurse has to go through before qualifying as a nurse, the various settings that are in nursing, the specialties that are there, and also to help you understand how you can use the nurse that is in you as a ministry to serve others. So tune in, let's journey together, and let's see what you can cover for today. So I have decided that this time around in this episode, we are going to discuss the nursing hierarchy. By hierarchy, I'm going to expose you to the various stages or levels of nursing that exist in the workplace. And I've decided to start off like this because I'll be mentioning these terms so frequently, and I wouldn't want you to be lost wondering who is that registered nurse or who is that certified nurse assistant. So to put in the same page as myself so that it is easier to understand, I also promise not to use heavy jargons and medical terms as much as possible, because sometimes it may not be possible, but at least this will help you understand what nursing is all about. So let's jump in, but before we do, I'd like to give you a Bible story that is related to what we're discussing today, and that is the story of creation in Genesis chapter 1. Before the world was created, the earth was empty, it was dark, and it was formless. And so God it was full of water, and the Holy Spirit was just hovering above the waters. Then God, being his nature, he spoke first before the creation and said, "Let there be light." And then there was light, and he saw that the light was good. Then he separated the light from the darkness, calling the light day, and the darkness he called night. There was evening, there was morning, and that marked the first day. And then he said, let there be a space, an expanse to separate the waters, because the earth was filled with water, to separate the waters above the heavens from the water below. And so there was an expanse. He called that expanse sky. It was good in his eyes. And so that marked evening came, morning came, and that marked the second day. And then he said, let the waters that are below on the earth gather together in one place, exposing the dry ground. And so he saw it was good. He named the waters seas, and the dry ground he named land. And then he said, let there be vegetation on that dry ground. And this vegetation are plants that have seeds in them so that they can propagate, and also trees. And the trees should be fruit-bearing trees. The fruits should also have seeds in them so that they can propagate. He liked it. It was good. Evening came, morning. That was the third day. Then the Lord said, let there be lights in the sky. And these lights should separate the light from the darkness. And so he created the greater light to govern the day, the lesser light to govern the night, and the stars to light the earth also. And that the light should point the earth to bring light. And so he said, let these lights mark days, mark years, mark seasons. And then he said it was good. And evening came, morning came, and that was the fourth day. Then he said, let there be fishes and all manner of sea creatures, both great and small, in the waters, in the seas. And also let there be birds in their vast array in the sky. And so he blessed them and said, be fruitful and multiply. Evening came, morning came, and that was the fifth day. Now, the final day of creation, he said, let there be animals on that dry ground, in the land, the dry ground that he named land. Let there be all manner of animals, livestock, wild animals, small creatures, crawling creatures. And he blessed them, telling them to be fruitful and multiply. And it is the same day that he also created man. And he said, let us create man in our own image, to be like us in our likeness. Ladies and gentlemen, I will stop my story, my Bible story here. So what's the essence of all this that I've explained? One day, evening and night, marking the first day, another evening and night, marking the second day. I'm trying to help you understand that God is an almighty God. He's a great God. He could have simply said, let there be creation. Everything would have appeared and he would have rested. But instead, he said he was creating everything bit by bit. If you have noticed, he didn't say, let there be fish. Much as the earth was full of water, he first ensured there was sea and then fish in it. He didn't say, let there be animals. Where would the animals go to? So he first of all created the land, and then he put the vegetation that the animals would need before saying, let the animals be created, let there be animals. After he had made everything and put everything in place, the very last person he created was man, because he knew that man would need that water. Man would need the days and the nights and the lights in the sky. Man would need that dry ground and the vegetation for food. And he was giving man the governance over all this creation. So our God is a God of order. Our God is a God of hierarchy. Our God is a God of levels. So let's jump in and let me explain how truly nursing is a ministry. How the very fact that God said, let us create man to be like us. We too, nursing in particular, we have created hierarchies just like God was creating in bits, bit by bit, every single day. Now, this is how the nursing hierarchy looks like. The most basic of nurses are called certified nursing assistants. Following the nurses, let's look at it as though it is climbing a ladder. So we are climbing a ladder, and the bottommost part of the ladder, we have certified nursing assistants. Following the nursing assistants, we have what we call the licensed practical nurses. Licensed practical nurse, or licensed vocational nurse. Following the licensed vocational nurse, or LPNs, sometimes you call them LPNs or LVNs, are the registered nurse. Registered nurse, whom we also refer to as the RN. Above the registered nurse are what we call the advanced practical nurse, APRN, advanced practical registered nurse. Advanced practical registered nurse, also known as APRN. Above the advanced practical registered nurse, let me retrace, pardon me. We have the certified nurse assistants at the bottommost, also known as the CNA. Then we have the licensed practical nurse or licensed vocational nurse, also known as the LPN or LVN. And then we have the registered nurse, also known as the RNs. Above the RNs or registered nurse are what we call the charge nurse, also referred to as the CN. Above the charge nurse are what we call the advanced practical registered nurse, also referred to as the APRN. Above them is the director of nursing, also known as the DON. And finally, at the topmost are what we call the chief nursing officer. They are also referred to as the CNO. So quickly, I will review at the bottom to the top, respectively. The certified nurse assistant, followed by the licensed practical nurse or licensed vocational nurse, LPN, followed by the registered nurse, RN, followed by the charge nurse, CN, followed by the advanced practical registered nurse, APRN, followed by the director of nursing, DON, and followed finally by the chief nursing officer, who is the overall nurse of the entire facility. So that this video is not too long and I don't want to lose you, I want you to understand what I'm saying. I have broken this hierarchy in two. Today, I will discuss from the chief nursing officer, from the certified nurse assistant all the way to the charge nurse. And in our next episode, I'll take it up from there all the way to the top, the chief nursing officer. All right. So we're going to start. The certified nurse assistant, much as this cadre is at the very bottom, these are the most important phase of nursing. They're the most critical phase of nursing because they are the foundation of nursing itself. Now, to become a certified nurse assistant, training takes approximately an average of 1 year. It could go from a few weeks to a few months, but rarely more than a year. So, what are they trained whenever they go for training? Various things. The basic things of a nurse. Think of it. There's something called activities of daily living, and this is what you as a person can do for yourself when you are whole and hearty. If you have nothing going on wrong with you, everything that you normally do for yourself, that is what we call activities of daily living. So when you're incapacitated, maybe by an injury or an illness, the certified nursing assistants come in. They do that for you. So let's just run down. What are these things? Well, assuming you've just woken up, you need to wash your face, you need to brush your teeth, you need to take a bath, you need your hair combed, you need to dress up, you need to use the washroom to go to the toilet, you need probably even to transfer yourself from the bed to the, let's say the wheelchair, or even to walk to the washroom. So if you cannot do all these things, nursing assistants do it for you. Pardon me, it's quite hot. So certified nursing assistants do that. They help you do everything from the transfer from the bed to the wheelchair, or if it's not a wheelchair, they ambulate you or they walk you to the bathroom. They help you take care of yourself, all the hygiene matters. Once you're fully dressed, you're okay. In terms of nutrition, they are trained probably to cook. And if probably they're in a setting like a hospital, they serve you your meal tray. If you're not able to chew the food as it is, they piece up the food, cutting it in pieces, in chewable pieces. They can feed you if you cannot feed yourself, or they monitor how much you're eating, how much you're drinking, in case of you're choking. The reason why I'm saying that they are the most important and the most basic of people. All these things I'm mentioning, should they see any change, should they see something out of the norm, these are the people that notify the nurses because they are the most basic. So they notify the healthcare provider or the nurses that something is wrong or there's a change in condition. So they're able to pick it up much faster before even the nurse may be able to. So once these certified nurse assistants have helped you with your activities of daily living, they've helped you with your nutrition, they've taken you to the toilet, you have helped yourself, they help you move around if you're not able to. They even taught how to transfer you. For instance, if they have to transfer you from the wheelchair to a normal seat where you want to relax and just recline and be comfortable, they just don't pick you. They're trained how to maintain body mechanics appropriately so that they don't injure their own backs or body. They don't injure their patient. How many times have you heard of a patient being transferred and, for instance, the wheelchair moved? So they miss the wheelchair, they are too heavy for the certified nurse assistant, and they fall on the floor. That is another case. That is another injury. That is another problem that has been incurred that could have been avoided. So the certified nursing assistants, they are taught how to transfer. Other than the transfer, for instance, it's time to take a nap or go to bed and they've transferred you to bed. And for peradventure, you cannot turn yourself in bed because you are paralyzed. So they are trained how to reposition you, place pillows, every 2 hours or every 30 minutes, depending on what the prescription is, they move you around. The moving around is very important so that you do not develop ulcers on your skin, what we call decubitus ulcers. So that turning around, moving, repositioning, it prevents pain, aches in the body, developing sores or ulcers. So they do that for you too. It is something that I can't quite exhaust what these certified nursing assistants do. And the reason is this: they are found in almost any setting, be it the hospital, be it an assisted living area, be it the physician's office, where else? Any location. They can work in any location as long as they have been trained for the number of weeks or months, or if it's a year, they have received a certificate. That is a license for them to practice in any setting where applicable, where required, where it is, where they can fit in. So not only that, but they're also trained to do basic life support. Basic life support, in layman's language, it is what we do or what they do in case they find you unconscious or losing consciousness. They are able to do that first aid, that very important first aid, to ensure that you don't lose your life while more advanced care is on the way. So they are trained to do that too. Ladies and gentlemen, that is what a certified nursing assistant is. Like I said, they're at the bottom of this ladder. They're the most basic of this nursing chain, but very critical, very important. It is them who will notice when your breathing has changed, and they notify the nurses. You may ask, where are the nurses? Nurses are there. They are on ground. But remember, they also have other responsibilities, documentations. They are contacting the healthcare providers. They are doing other things to care for the patient. So, but the certified nursing assistant is one-on-one with the patient most of the time. So they are in more contact, more frequent contact, and they are able to pick out things. For instance, when they are bathing the patient, and they notice that there's an area in the skin that is reddened. According to nursing, that is a sore at the first stage. So it needs to be caught before it moves to the second stage. So when they're bathing the patient and they notice the red stage, they are more likely to notice it before the nurse has noticed it. So at that time when they're bathing, they're able to raise it up. And that is why I can't insist that they are very, very important people. Do they do vital signs? You may ask, what are vital signs? Vital signs is the pulse, how fast your heart is beating, your blood pressure, how high is your blood pressure, how low is the blood flowing through your veins and your heart is beating. So the pulse, the blood pressure, the temperature. How high is the temperature of your body, or how low is it? Your respirations. That means how fast or slow your breathing is. So we have the temperature, the pulse, the respiration, blood pressure, and they also check the level of pain. They're able to ask the patient, are you in pain? If the patient says yes, on a level of 0 to 10, where would you scale your pain? And the patient would probably say it's just 5. Not too much, not too low, but I'm uncomfortable. So they're able to also ask and report this. Please understand, much as I say, they're able to pick up so much and tell the nurse. That doesn't mean nurses are not trained to do all these things. That is why it is a hierarchy. We have started at the bottom, but remember, the ones on top already know what the certified nurse assistant knows, only that they are trained to do even more. So I'm just mentioning this, but as we go ahead, you'll realize that the rest of the cadres also, they know these things that nursing assistants do. So do they document? Certified nursing assistants have to document. They have to write down everything they have done, everything they have served the patient with. By that, I mean even the food that they serve the patient or the client, they should document and say a whole plate of food, a whole tray of food. That means your food on the plate, the milk, the juice, the water, everything, we consider that 100%. So for the food in your plate, as 100%, when you eat, they're able to approximate and say, patient ate 50%, if ate half the food. or patient ate 25%, or patient ate 100%. For the fluid, the juice, the milk, and the water, any kind of fluid on your tray, they are meant to measure that you drank 100 milliliters of juice, 300 milliliters of water. So we call that the input, and they have to document the input. When they take you to the toilet and you pass urine, the urine is measured. And so they're able to say the intake, everything that you drank during the shift, and the output, everything that you passed out. And this helps us as the healthcare team to be able to know whether you're losing more than you're gaining or you're gaining more than you're losing. And by then we can intervene as appropriate. It was quite a long explanation, but that is what certified nursing assistants do. And you see their importance. So much as I've not exhausted what these people are, who these people are, we're going to move on to the next level. And these are the licensed practical nurse, also called licensed vocational nurse. In some countries, most commonly Africa, you'll hear them being called enrolled nurses. And there are other various names that they use. So the licensed practical nurse comes between the certified nurse assistant and the registered nurse, meaning they do everything I have just explained about certified nursing assistants, but they don't do quite as much as what registered nurses do. And that is because their training has been limited. Now, looking back at years ago, I'm talking decades, this used to be the basic nurses, the licensed practical nurse. Because a nurse used to be known as one who does what I've explained certified nurses do, and also give medications. But as time evolved, time went by, there was need for nurses to step up and be able to to do much more in order to save lives. Not to say that these licensed practical nurses don't save lives, they do. They are very important also. They're important because it lessens the burden of nursing, so that while registered nurses have to do more and take care of other pertinent issues, licensed practical nurse can do things like they're trained to give medications, but not all medications. The medications they can administer to patients are limited. They are limited, and most especially medications that we swallow, and those are called oral medications. I'll explain why. So they give limited medications. There are some critical medications that are left for the registered nurses to give. Then they can give some injections. By this I mean they can inject in the muscle, they can inject in the tissues. There are various sites in the bodies that we call tissues. They can inject that, but they're not allowed to inject in the vein. Now, the reason why I've said oral medications and they're not allowed to inject in the vein is because the medications that go straight to the blood have started working almost immediately. It has gotten into the circulation. And so these are a bit critical compared to a medication that you're swallowing. By the time it goes down your tract, it gets to the stomach, it meets with the acid, it is absorbed, it gets through the muscles of the stomach to the bloodstream. It may take an hour, 30 minutes or so. So, licensed practical nurse, because that is the level of training, it is left for them to do some medication, while the rest, the registered nurses take care of. Other than that, pardon me, I didn't mention how long their training takes. Now, these licensed practical nurses go for training for approximately or averagely 2 years. Averagely 2 years for them to be qualified. When I say averagely, in some countries or jurisdictions, they require them to do 1 year, 1.5 years, 2.5 years. That's why I'm talking of averagely. It varies. So once they have qualified, they have finished their training, they do their board exams, and now they're licensed. They're required only to do the medications, some medications. And then, like I've said, they do everything the certified nursing assistant does. They also have the certified nurse assistant work under them. meaning they are in charge of the certified nurse assistant in any shift of work. So they're able to guide them, direct them, work together with the certified nurse assistant, or rather, the certified nurse assistant reports to them, while the licensed practical nurse reports to the registered nurse. The licensed practical nurses can also do reinforced teaching of the patient. What do I mean by reinforce? Once the registered nurse has given the first instruction to the patient, maybe teaching them about diabetes, teaching them about their wound dressing, the registered nurse does the first teaching. So the licensed practical nurse is allowed to reinforce. They only repeat what the registered nurse has said, but they're not allowed to give that first teaching. It is left for the registered nurse. Then we have the admission and discharge. Again, they're not allowed to do the first admission or the first or to discharge the patient. And the key reason is during admission, assessment has to be done. By assessment, I mean the nurse will look at the patient and be able to find out what is happening with the patient. Of course, the physician does the medical diagnosis, but they're able to determine what the patient needs, then put a nursing diagnosis out there, and then set up a care plan, how this patient is going to be cared for. And then there's the implementation, the planning, and the evaluation. So that very first stage is left for that registered nurse to do everything, assess and set the patient. Once that is done, now the licensed practical nurse can continue implementing what the registered nurse has already set. So they implement, and then that is why I've said the admission is left for the registered nurse. The licensed practical nurse is not allowed to do that admission for reasons of, or the purposes of assessment. And then the discharge is also left for the registered nurse because teaching is involved during the discharge process, where you tell the patient when they get home, this is what they're required to do. Their medications, these are your medications, this is how you'll take them. We'll discuss this in the subsequent episodes. So licensed practical nurse cannot do that admission and they cannot do that discharge. It's left for the registered nurse, but they can now implement and monitor the patient between the admission and the discharge point. I hope I haven't lost you, ladies and gentlemen, but that is licensed practical nurse for you. They do more things, and I will bring it up as we journey on. But this is for purposes of you understanding this hierarchy. Now we go to our third step, and these are our registered nurses. Now the registered nurse is what I will call the total nurse. Inside a registered nurse is a certified nurse assistant, is a licensed practical nurse. They're the total nurse because they have been trained to do what a typical nurse is all about. Everything a nurse should do really is packaged in a registered nurse. So they've been trained to do approximately 98% of who a nurse really is. So the limitations you hear me saying, certified nurse assistant can only do this, they cannot give any medications, or licensed practical nurse, or they can only do all this, but they cannot give some injections, they cannot perform some procedures, of which I forgot to mention. This licensed practical nurse assists in procedures, what do you call it? Some specimens, they can take some specimen like urine or, a stool. They can take some specimens, but there are others like bone marrow. Now that is left for the registered nurse. So this registered nurse is the total nurse. They have been trained to do almost 98% of what nurses really should do. And now when I say that, I've already talked about what certified nursing assistants do. I've already discussed what licensed practical nurse can and cannot do. Now putting all that together, let's just say the registered nurse can do everything a nurse can do. And that means admitting the patient into the facility, healthcare facility, setting up the care plan. A care plan is a plan of how we are going to care for the patient. That means I have seen this patient, they have been admitted with a headache and they're running stomach and they have a wound. You know everything about the patient. They have a fracture, they've gone to surgery or they should be going to surgery tomorrow. They take all the information. Then they plan how they're going to take care of the patient as a nurse. As a nurse, that is the diagnosis of a nurse, how they're going to take care of this patient. And that means maybe ensure they are repositioned every 2 hours, ensure that the head of their bed is raised 30 degrees to promote breathing, to ensure that the side rails are raised so that they don't fall off the bed, maybe because they have confusion. So the registered nurse sets up the care plan of how this patient will be cared for. And then the implementation process, they continue doing what they have set up in the care plan, and then evaluate whether what they're doing, is it working? Is the goal being achieved? Or is it being achieved only 50%? Does it need to be readjusted or anything added, you know? And then finally, after implementing and they evaluate, they're able to tell whether they are achieving their goal. So that's what registered nurses do. Another thing registered nurses do, apart from admission and discharges, they do teaching or education of the patient. I have already gone through that. They teach the patient about the medication. They teach the patient about the effects of the medication. They teach the patient about their health status. You know, why are we doing this? Okay, the physician has ordered the breathing treatment. This is what the breathing treatment will do. You know, so it is an ongoing process throughout the stay of the patient in a hospital. And even if it is at home, whatever a health setting, registered nurses do the teaching. They teach the patient because they want the patient or the client to participate in their own health care. So, and this helps them to also to heal faster and to be more independent. What can I say? What have I left out? Registered nurses do documentations like the licensed practical nurse, because in nursing we have this saying, if it was not documented, it was not done. If you do anything, whether a certified nurse assistant, a licensed practical nurse, or a registered nurse, if you do something, you have bathed the patient and you have not documented as a certified nurse assistant, you have given that medication the patient has swallowed, but you did not document, you did not put your signature that you gave the patient that medication and they swallowed. Or you're a registered nurse, you set up the IV, the intravenous medication, you injected them, the medication has run in for 30 minutes, you put in a whole 2 liters of fluid into their body, you gave them blood, you transfused blood, and you do not document all these things. It was not done. It was not done. As long as it was not documented, it was not done. So all of us, the certified nurse assistant, I will shorten, I'll be calling them CNA for certified nurse assistant, LPN for licensed practical nurse, and RN for the registered nurse, so that I don't keep talking so much. So I hope you've understood. So registered nurses do that. They do all that I've mentioned, including documentation. Very, very important, very important. We'll have an episode where I'm going to discuss documentations for nurses. Then, another key thing, registered nurses liaise with the other healthcare team. Remember, when you're being taken care of, maybe you're ill or injured, You may end up having the physician or the doctor, whom we call the healthcare provider. You will have your nurse, registered nurse. You will have your probably the certified nurse assistant. You will also have the physical therapist who tries to help you get back into full mobility. So the physical therapist who does the stretching, helping you to take steps and learn to walk again, all these things. You may even have an occupational therapist. These are people who help you now probably learn to dress up again, learn to eat again, to make your hair, we'll talk about them when you get to the specialties and all. So it is the registered nurse who will now be liaising with each and every one of them. So it is upon them to call the physician and say, you did prescribe that I give patient A paracetamol. I have done so. However, the patient's pain has not been relieved. Could you kindly prescribe more pain medication? And so the physician may end up saying, okay, go ahead and give them a tramadol injection. That is much stronger a painkiller. So the nurse has liaised, the registered nurse has liaised with the healthcare provider concerning the patient. So they're between the doctor and the patient. Then they will call the physical therapist and probably tell them, just confirm you do have an appointment with our patient at 10 a.m. Are you aware? And the physical therapist may say, yes, I'm aware. I'm actually on my way to pick the patient to the physical therapy department. So again, they will liaise maybe with the dietitian concerning the patient's diet and talk to the dietitian and tell them, yes, the physician has prescribed a new diet for this patient. They will no longer be able to feed orally. So we've put in a tube through their nose. So we'd like you to come and review the patient because the doctor has ordered a certain liquid diet. So the dietitian will come and also assess the patient and do what they need to do. So you see all these other people that surround it. It's not just the doctor and the nurse. We have other health cares. We even have the engineers. In case of a machine breakdown, the registered nurses are also able to bring it up. But I will take you to the next stage, having mentioned the machine. So ladies and gentlemen, I hope we have a good idea who the registered nurse is and that they have the licensed practical nurse working under them, together with the certified nurse assistants who are also working under them, but more closely with the licensed practical nurse. Fine. Having discussed the registered nurse, we are going to the charge nurse. And with the charge nurse, I'd like to give a scenario so that it will be easier now to place this charge nurse in the entire hierarchy. Because you have said in the next episode, we'll take it up from there to the chief nursing officer. So this charge nurse, I want you to picture a ward. Some people have never been to hospital because they've never been sick, which is a blessing, a very big blessing. And they probably have never had anyone close to them sick, so they've never been to a hospital setting. So assume this big hall, an Hall, a hall, and it has beds. That is a setting of a ward. However, we also have places like corridors. So imagine a hallway or a corridor, and there are rooms on this hallway, and in each room, either there's one patient with one bed with a patient in, or 2 beds in each room, or 3 beds in each room, depending on the setup. All I need you to understand is how a ward looks like. That is a collection of beds with patients. Fine. The healthcare workers, when I say healthcare workers, I mean the certified nurse assistant, the licensed practical nurse, the registered nurse, and now we are talking about the charge nurse. They have all shown up on duty to the healthcare facility, whether in the hospital or in the nursing home, they have reported to duty. Now, in nursing, we have what we call shifts. Shifts is the collection of hours these healthcare providers have to work. So some shifts can run for 12 hours, for instance, 7 a.m. to 7 p.m. Other shifts run for 8 hours, like 7 a.m. to 3 p.m. So it's just a matter of dividing that in 24 hours. So you understand, if you have a shift of 12 hours, then that means all these healthcare providers will be working in two teams. The ones that come during the day, 7 a.m. to 7 p.m., and the next shift that comes from 7 p.m. to the following day, 7 a.m. So we're now talking about this day shift or morning shift that is coming to work 7 a.m. to 7 p.m. They have all shown up together at work. They go to the duty rota, and this is where the schedule has been placed. So when they look at this duty rota, it tells them where they are working. And of course, probably the ward, for instance, we have ward number A, that is a hall with beds, or a hallway with rooms with beds. So we may have ward number A, ward letter A, we have ward B, and we have ward C. I hope I haven't lost you. I've talked about a ward and how it looks with beds and how it has patients, or it is a hallway with rooms and the beds are there. That is also a ward. And I've talked about this healthcare provider comprising the certified nursing assistants, comprising the licensed practical nurses, comprising the registered nurses, and now the charge nurse. They have come to work, they go to the rota to see where they have been placed to work. So once they identify that you need to go to Ward A, the certified nursing assistants that have been assigned to Ward A move on to Ward A. Those assigned for Ward B move to Ward B. The certified nursing assistants for Ward C, they disperse to Ward C. So we have certified nursing assistants that have taken their places in each of the wards. Then the licensed practical nurses who have also shown up, they check where they are working, and they have been assigned whether Ward A, those for Ward A move to Ward A, those for Ward B take their positions, and those for Ward C take their positions. Similarly, the registered nurses do the same. Registered nurses, each of them takes their position, and the charge nurse now is where I want to hone in. So now we understand that when they each go, the health workers for Ward A, when they sit together in the morning to receive the report that morning, because they have to get report from the previous shift, they find themselves seated around this table with the certified nurse assistants, the licensed practical nurses, the registered nurses. In each of the wards, that is the scenario. Once seated for the shift, there's this now personnel called the charge nurse. Now, in each of these wards is a single charge nurse. And the charge nurse is now the head of these various teams. Team Ward A, with the CNAs, the LPNs, and the RNs, they have a charge nurse I'll explain their work. Then the Ward B, the CNAs, LPNs, and RNs have a charge nurse above them. And then Ward C, they have the CNAs, the LPNs, and the RNs above them. I hope we are together there. Now, in some circumstances, they may not be able to have a charge nurse in each ward. Instead, they have a charge nurse that is responsible for that entire shift. One charge nurse manning Ward A, Ward B, and Ward C. And if they have enough personnel, then they have a charge nurse for each unit. I hope you're together. Now, this charge nurse has to be a registered nurse. Remember I told you, the registered nurse is the total nurse. Because moving on from here, up the hierarchy, you must be a registered nurse to climb the ladder. It's almost impossible to move from a licensed practical nurse and overtake and become a charge nurse moving up. So it is more common that you first have to be a registered nurse, have some years of expertise before you can now become a charge nurse. So the charge nurse has to be a registered nurse. Even the APRN, the advanced practical nurse, has to be an RN moving forward. So you may say, what's the difference between the charge nurse and those above them? I will explain that in our next episode. Be sure to tune in if you want to understand more. But this charge nurse is a registered nurse who has had more years of experience. And that is why I kept saying the certified nurse assistant, they are very important, because even to become that charge nurse, you must know what the certified nurse assistant does. You must know what the licensed practical nursing assistant does, licensed practical nurse does. You must have been a registered nurse yourself to know how the flow runs. So their training really is that they have to be a registered nurse with years of experience. And after that, for them to be in charge of the other nurses, what they're doing really is to ensure the safety of the patient. The first thing is for the safety of the patient and the effectiveness to manage the entire shift and manage the workers. You can imagine when everyone is just, yes, I'm a certified nurse assistant, I am performing my role, I'm a licensed practical nurse, I know what I've been trained to do, I'm a registered nurse, it will be very chaotic. And in the end, the patient is the one that has been put at risk. So we always say it's for the safety of the patient that it has the entire care during the shift has to be organized, that we have to know who is responsible for what. So it is the responsibility of the charge nurse to that duty rota, the scheduling. The charge nurse has to know each and every patient under their jurisdiction. If it is the entire 3 wards, Ward A, Ward B, and Ward C, they should know what the patients are all about. I'll explain. And if it's just Ward A, they should know what the patient's conditions are like. So they have to know that in room number 1, the patient has been in the facility. This is their 3rd day since admission. This patient came with this diagnosis, maybe profuse diarrhea and vomiting. Patient in room number 2, they came after a road traffic accident. They went through surgery. This is their 3rd day post-operation. They have to know that a patient in room number 7 is a pregnant woman who is vomiting profusely, which you call hyperemesis. They have to know that in room number 4, 5, and 6, those rooms are empty, that the beds are empty, and have the beds been cleaned or are they in the process of being cleaned. They have to know that patient in room number 10 has been discharged by the doctor and they are in the process of clearing the bill to leave. They will have to know that patient number 13 has been discharged verbally, but it is yet to be signed in the file officially. So they have to have all this nitty-gritty information. So they know that probably they have 30 patients. It is the duty of the charge nurse to determine which patients they are allocating to the registered nurse, which one they are delegating to they are allocating to the licensed practical nurse, which ones can be allocated to the certified nurse assistants. It is their duty to know the rules or the principles for delegation. Here is an example. All the patients are not the same and they're not on the same critical level. So like we have already discussed the licensed practical nurse and the kind of patients they are licensed to care for. So the charge nurse will go through their patients and determine that nurse X can take care of the patient in room 4, 5, 6, 9, and 14 safely. Safely because it is within what they have been licensed to do. and they know that I have 4 registered nurses. Now, I have, with my 4 registered nurses, I can allocate maybe 4 patients for each. But my 4th nurse, I will give them only 2 patients because these are what we call heavy patients. Almost critical. I won't use the word critical because the critical patients are in ICU and critical care. But they are able to assess. They are assessing the patient to see, is this patient, can this patient be safely cared for together with other patients? How many other patients can be added to them to be delegated to this nurse? So the nurse will be able to be, you might find that a registered nurse, one registered nurse has 2 patients. The second registered nurse has 5 patients. The third registered nurse has even 6 patients. And that is the nurse-patient ratio. And so it won't be a matter of why it is unfair. How come some registered nurses are taking care of 6, there's somebody else with only 2? That balance has been created because this one with 2 patients can safely manage the 2 patients because they require so many things. They probably have a wound that needs to be dressed. They have a tube running through the nose, and that's where the feeding is being done. They have oxygen machine on them. They require frequent turning. They require every 30 minutes vital signs, the blood pressure checked. So they have so much going on with them. And like I've said, the main reason we have the hierarchy is for the safety of the patient. So the charge nurse comes in to be able to give each nurse the number of patients and critical level of patients to every one of the nurses, the registered nurses. And the same for the licensed practical nurse. Now the charge nurse assigns the licensed practical nurse to their patients, but working under the registered nurse. So this licensed practical nurse knows their level of duty. This is how much I can do. This is how much my license requires me to do. But the nurse that I am reporting to is nurse X. And then the certified nursing assistants, please remember I've said these are the bedrock of nursing. They cannot just take care of all the patients. Even if they're assigned 555, it is the charge nurse again who determines that this kind of patient cannot be bathed and assisted with the activities of daily living by a certified nursing assistant. Therefore, I will not assign this patient a certified nurse assistant to help them with the activities of daily living. Because of their condition, this patient is solely assigned to the registered nurse or a licensed practical nurse, but it is not safe to give such a patient to a certified nursing assistant. I do hope you are at the same page, ladies and gentlemen, because I've tried to break all this down to help you understand the role of a charge nurse and how important it is also. Because if they get it wrong, there'll be so much chaos in the work. The patient's lives are at risk because a certified nurse assistant will go ahead and start bathing a patient who probably has a dressing that does not require water to go to it. They are probably transferring a patient who is on bed rest. They are not supposed to leave the bed for the next until the doctor prescribes, and yet they have picked the patient from the bed, transferred them on the chair. They are in the shower. This patient is on a breathing machine, yet the certified nurse assistant has taken them to the shower instead of a patient who should have been bathed in bed. So the importance of a charge nurse is to coordinate all this, the scheduling and who does what in the ward. Another thing the charge nurse do, they ensure that the machines are working. So if a machine is found to be faulty, it is their duty to call the engineering department to ensure that machine is fixed immediately, and it is their duty to ensure that a replacement is already on ground so that the registered nurses, the LPNs and the CNAs can continue working seamlessly. Again, the charge nurse is the one that takes the calls Remember the admissions, I've mentioned there are beds that are empty. There are people that there are patients that have been discharged, those in the process, those that have cleared discharge. The charge nurse must know all this. Because when they get a call, for instance, from the director of nursing or the emergency room, when they ask them, when they tell them we have a patient that we want to admit to your unit, they should know whether there's a bed empty, whether the bed has been cleaned. Cleaning is not just water and soap. I'll explain later. There's sanitization that goes on. So it is upon them to be able to know, yes, I have 3 empty beds. They are ready for admission. Go ahead and bring the patient. Or they will say, hold on to the patient for another 1 hour because the cleaning is in progress. Or they can say, we are full in the ward. There's no empty bed. Or they can say, there's one patient whom the doctor is reviewing for discharge, so you can hold on until we get back to you. Or they can look for another alternative. But they're trying to say, this is the capacity, this is the patient population that we have, these are the empty beds, these are the beds that will be empty because the patient is still going through their discharge. Because you cannot remove a patient from the room because they've been discharged, and until they clear the bill and the badge has been removed, they cannot leave the room because of dignity. So they have to be set up until they're discharged with dignity. The room is cleaned and sanitized, and once ready, then they receive the patient. So the charge nurse does all this coordination, ladies and gentlemen. Finally, because of time, I'd like to say that in case of any escalation of violence happens in the healthcare setting. We have patients who come with mental disorders. We have patients who come confused and very volatile. We have families who come so angry because of maybe their patient is not, their family member is not getting well, or the treatment that is being administered according to them is not working as fast. There are things that happen. They've lost a loved one, they're angry, they're having emotions. So the charge nurse, it is their responsibility to go ahead and pull the patients aside and try to calm that down. Call security if need be, or try and talk to the patient. And of course, they are registered nurses, so registered nurses do the same thing. But you can imagine the other patients are also there to be cared for, so they can all not stop what they're doing to try and quell this emergency, this situation. So as much as possible, the registered nurses continue caring for the patients. The charge nurse brings in tries and what do you call it? Contain the situation and able to liaise with the director of nursing, bring in security, and until everyone is safe. The patient is safe. The LPNs, CNAs, RNs, everyone is safe. Everyone should be safe during a work. During the shift. I am very sure I have not exhausted everything about a charge nurse. Let me mention this. These charge nurses, it does not mean that they cannot work remember they're registered nurses, so it does not mean they cannot work directly with the patients. So if at any time they have done the scheduling, they have checked the machines, everything is moving smoothly, the charge nurse can go ahead and administer care to a patient. So it is upon them to use their judgment and know that this nurse is still working on patient A, and so because they're still tied up, let me go ahead and administer medication to the other patients. So it is, as I've been discussing, you've seen, it is a teamwork. Everyone has their own role, but they're all working for the good of the safety of the patient and also for effectiveness sake. Now, what about the supplies and the medications? Again, it is a charge nurse to monitor. How are the supplies flowing? Do we need more bandages? Do we need more antiseptic? Or the solution is running out? So they will go ahead and make the order from the procurement office. They make the order, we need 30 bandages, we need 6 gauzes, we need 10 rolls of cotton wool, all that, they make all that order, and it is brought and restocked back in the ward. The medications also that are required, do we have enough insulins? Is the refrigerator stocked with enough of A, B, C, D? So medication-wise, they also monitor that what is needed is there. I hope as we go ahead, as we journey in the next episodes, and I bring these cadres up, CNAs, LPNs, registered nurses, and the charge nurses, anything that I've left out, I hope to bring it up. And if you have any comment that you want to add or you want to correct, kindly be free to comment and let us know what is in your mind. After all, it is something that it is a platform to educate and just to expose us on what the nursing hierarchy is all about. Let me finish off by saying, I gave a story about Genesis chapter 1, a story in Genesis chapter 1 about creation, how God created us in his own image. He said, let's create man to be like us. And he also took one day after the other to create. When you hear me discussing CNA, LPN, RN, and CN, are you seeing a pattern? Are you seeing the image of God? That we too, nursing as a ministry, we have that CNA, we have that LPN, we have that RN, building up to the CN, and still further, as we will see next week. I started off as a certified nursing assistant, and I did it because I had to raise tuition for myself, to take myself through college. My parents could have done it, but I thought, well, the job is available. The training at that time was only 6 weeks. Why not go ahead and train as a certified nursing assistant so that I am able to pay myself through college? And it worked perfectly well. I would go from work to college, from college to work. So everything I learned from work as a certified nurse assistant, the things I see there, and I do not understand, I would raise it up in school and ask or even try to explore with the lecturers. And anything the lecturers would bring up, and I would relate to my patients at work, I would apply it at work. So by the time I was doing my nursing rotation, we call it clinical rotation. That means working with the patients in the ward as a student. To me, it was much easier because I'm doing it every day as I work, as I pick my shifts at work. So whatever I'm doing in the ward really is exactly what I'm doing at work. So if I was to advise anyone, if you have the finances allow and the timing allows, maybe you are waiting to get into nursing school, go ahead and do the certified nursing assistant. It will make your work so easy, whether you want to do licensed practical nurse or whether you want to be a registered nurse. And it will make nursing enjoyable because it won't be a chore. It won't be stressful. It will just be something you're doing effortlessly because you're doing it at work and you're doing it in college. Ladies and gentlemen, thank you so much for sitting still, listening to me, trying to explain who a nurse is. Now, you may wonder, so how does that apply to me? Join me in my next episode. As soon as I finish explaining to the highest cadre, which is the Chief Nursing Officer, the only three. Now we're going to discuss the advanced practical nurses, the director of nursing, and the chief nursing officer. As soon as we do that, I will explain how this cadre is so important to you to apply as using the nurse that is in each and every one of us, to apply that nursing hierarchy that I have explained, the CNA in you, the LPN in you, the RN in you, the charge nurse in you. You'll be surprised. The CNO in you. I will help you bring that out and show you how you can serve your family members and even the community at large. I have enjoyed this episode and sharing all this with you. Once again, my name is Ludia Osita. Until next time, have a beautiful day. Goodbye.